as Dr. Heyman said, we're going to focus today on the stress response and the manner in which your body mounts a stress response. And my topic is going to be to basically discuss some of the treatment options that are available. First of all, I want to say that trying to cover this broad a topic in 45 minutes is impossible because there are so many different ways in which cortisol release patterns can be abnormal. I know a lot of us have become familiar with the term adrenal fatigue. However, that really is just one minor component of the many different ways in which cortisol release patterns can be abnormal. And so as I discuss the treatment options, I will put into perspective the fact that this does not always apply to just low cortisol. Some of these treatment modalities also apply to people with excess cortisol production. And also not all modalities will work for all patients, depending on where the problem lies. So the objectives of my discussion essentially are to discuss different components of treatments using an evidence-based approach. So all of the information that I review today is evidence-based. It's cited in the medical literature, and the citations have been listed here for you. If you cannot write them down, or if you don't have availability, please let me know, and I'll be happy to get them to you. We'll discuss glandular extracts, plant adaptogens, and a brief overview of pharmacologic therapy that is also acceptable. So again, just to put things in perspective, there really is a difference between hypothalamic pituitary adrenal or HPA axis dysfunction and then just isolated adrenal dysfunction, which as we progress in our talks, as we present, we will show that that's actually the minor number of cases, and actually it's HPA dysfunction, HPA axis dysfunction that is the main modulator of abnormal cortisol release patterns. But in the context of adrenal dysfunction, to define that so we know in what context we're speaking, it's the inability of the adrenal glands to produce appropriate amounts of hormones in response to a secondary, primary or secondary stress response. And then basically you ultimately get a state of hypocortisolism. The adrenals can fail to produce cortisol for a variety of different reasons. And again, that's outside of the scope of this talk. We hope to present that in future discussions. But sometimes it's a lack of the brain telling the adrenals to do it. Sometimes it's a lack of substrate for the adrenals to make cortisol. Sometimes the adrenals simply can't make cortisol. And again, different mechanisms by which low cortisol can evolve. This is one author's rendition of the proposition of progression to a low cortisol state. And so those of you who are familiar with Selye and his work, and he's the author and the forefather of the general adaptation syndrome, whereby he discussed the manner in which chronic stress affects physiological organisms to the point where they will reach a state of exhaustion, as he put it. And at that point, you have reached a low cortisol or flattened cortisol curve, otherwise known as hypocortisolism, where you have inappropriate amounts of cortisol production. The treatment modalities that I'm going to discuss, again, are all evidence-based and include things like stress reduction techniques, sleep hygiene, lifestyle modification, vitamins, minerals, glandular extracts, plant adaptogens, and finally pharmacologic therapy. So first of all, we'll discuss stress reduction techniques, and one of the things I will stress to you in the length of time, at least I've been practicing, is that unless the patient is willing to make lifestyle changes, nothing you give them or do for them will help, because they have to truly identify from whence their stress is originating, whether that's internal or external in nature, and they need to address that major component as an essential part of treatment. There are some basic ideas here, things regarding exercise, etc. There are studies to show actually that people who have a religious belief, spirituality, have more functional HPA axes during chronic stressors. Dietary aspects will also be discussed. Meditation, there's a lot of information and evidence to support the use of meditation in trying to re-equilibrate HPA axis dysfunction. So on to meditation. Basically, meditation allows several different physiological processes to be affected in a favorable manner. By reducing stress-induced cortisol secretion, a variety of other things will then happen. And one of those things is interleukin-6 reduction. Also, the brain-derived neurotropic factor, which actually confers neuroprotection, is favorably mediated by meditation. There's one study that's been done that I found on breast and prostate cancer survivors, and meditation actually helped improve their cortisol release patterns and hence their quality of life. There's also some evidence to show meditation has been clinically useful in patients who have inflammatory bowel diseases, as well as coronary artery disease, and some of the methods of modes of regulation are listed there for you. Dietary modification. There were several good studies that I found. This one from 2007 actually examined the effects of a Mediterranean diet on patients with HPA axis dysfunction in particular. And they found that basically when you consume a Mediterranean type diet, it helps to keep cortisol levels more regulated and promotes less HPA axis dysfunction. This particular study by Gibson, they did on patients trying to see what a protein load would do to their cortisol levels. And they measured salivary cortisol patterns, and they noted that there was an acute protein-based, meal-dependent rise in cortisol, and it was directly proportional to the amount of protein ingested. Now, this has important clinical implications in the, thank God, reduced popularity of the Atkins diet, but this study showed that the degree of protein intake, especially in women, directly correlated with their lack of sense of well-being, presumably secondary to the accelerated or increased risk of, secretion rather, of cortisol. This 1997 study of 35 healthy male non-smokers, basically these patients were subjected to an 8 to 10 hour fast. And the researchers found that in such a situation, the adrenal's ability to mount a stress response is blunted. And after they gave their study subjects a glucose load, within 1 hour, these adverse blunted stress responses were reversed. And basically the mechanism by which they feel this evolves is that glucose then causes insulin to increase, thereby precipitating a cascade of events resulting in production of serotonin and then ultimately HPA axis activation. Okay, moving on to the vitamins and minerals. There are a variety of different vitamins and minerals that have been recommended in the use of a treatment for HPA axis dysfunction and abnormal cortisol release patterns. And keep in mind that you can have an abnormal cortisol release pattern secondary to a variety of different problems, heavy metal toxicities, for instance, nutritional deficiencies. And so in that context, some of these things may not be directly related to improving adrenal cortisol production, but by removing the stressor or the condition that is fueling that problem, then there is an indirect improvement in cortisol release. Magnesium, quite a bit of literature on magnesium and its beneficial effects in a variety of different contexts. Magnesium has 3 primary functions. Calcium antagonism, it's important in membrane function, and it's also important for energy transfer. And as such, it has over 300 components, enzymatic reactions, in which it is a participant or a cofactor.